In honor of my next guest, he is Dr. Tom Vangilder. He is the Chief Medical Officer for Walmart. He is also formerly of the Centers for Disease Control and Prevention. Welcome, Dr. Tom.
Thank you, Roshini. It's good to be with you.
Let's first start by talking about the coronavirus, because the CDC, we're seeing them in the news right now, lots of different quotes coming from different places. At last count, the impact, infections worldwide, 100,000, deaths worldwide, 3,400, known cases in the U.S., 400, and as of today, U.S. deaths, 19. Do these numbers surprise you?
Roshini, they don't surprise me. We've been watching this situation develop over the last couple of months. I think the really good news in knowing the numbers themselves is that we have a very engaged public health system. We have a global response going on right now with a lot of information sharing. And I think it's fair to say that at this stage of this coronavirus's life cycle, if you will, we know a whole lot more about it than we did previous coronavirus situations. So that's good news, and it should give people some information to process, but also to not panic over, to plan and prepare and be patient, but not to panic and not to obsess about any particular numbers.
Dr. Tom, you have more information than we do. So when you say any previous coronavirus situations, are those that were known to the world at large?
There have been, and you've heard of so-called SARS and another outbreak called MERS, MERS. Those were caused by coronaviruses as well.
Okay, so this is a different strain.
Correct. Coronaviruses are a family of viruses. They're really quite common, and this is this new one that we're talking about that's causing the disease that's being known as COVID-19 is a new coronavirus that was identified in China late last year.
Right. So here's the thing, though. When we hear about, conferences closing, companies stopping travel to many parts of the world or some parts of the world, to people deciding not to go on trips, is that too much right now, or are you okay when you hear those kinds of reports?
I think one of the things that we look at from a public health perspective and just from a public perspective is thinking about health as a community resource. And one aspect of that is situations like this where public health is telling us we need to try to slow down transmission of the virus. And that involves washing your hands, covering your cough or sneeze with a tissue and throwing that out, staying home if you're sick, trying to keep distance from people who are obviously ill with symptoms of this disease, which seem to be fever, cough, and shortness of breath. Those things help us slow down the transmission of a respiratory virus like this. So efforts that are being made to avoid large gatherings, to avoid areas that have undergone rapid transmission that we've seen in different places around the world, I think are all prudent public health measures that everyone's taking. And again, it not only helps protect us as individuals, but helps protect our communities.
I'm talking with Dr. Tom Vangilder. He's Chief Medical Officer for Walmart, formerly with the Centers for Disease Control and Prevention. He is, in fact, a doctor himself. He's a board-certified internist and preventive medicine specialist, so he really does know what he's talking about. One of the things I think is so fascinating about what Walmart is doing now, and you said it, really looking at health as a community resource. How is Walmart kind of trying to get that perpetuated around the country right now, Dr. Tom?
What we're doing at Walmart Health is trying to bring access and affordability to quality care in the communities we serve. Our real goal is to be centers of well-being for the communities. We have 4,700 stores, which include pharmacies, and about 3,000 of them have vision centers. And we've just opened in the last 6 months or so 2 health centers, both in Georgia, one in Dallas, Georgia, one in Calhoun, Georgia, that's designed to create an experience in healthcare for individuals that takes care of them as a whole person. So we have dental practices and primary care medical practices and behavioral health and lots of supportive testing and other things that people think about and need when they want to seek health care, but also placing it in the communities, in the Walmart, where people are already coming. We see about 150 million people in this country coming to a Walmart every week. And then delivering that in a way that is simple, accessible, and affordable. And what we do with affordability is really try to deliver a complete healthcare package. So not just an episodic or urgent care type of setting that we do see people with acute needs, but provide long-term, longitudinal care, as it's sometimes called, for people with complex illnesses. And again, at a price that they can understand and afford. So it's really that affordability, accessibility, and quality that we're trying to bring to our communities, and doing it in ways large and small.
You know, on my Facebook page a couple days ago, I put a picture of one of your centers. I mean, it looks like a hospital, really, but it's in one of your Walmarts. I believe it was the Dallas Walmart. And I think it's fascinating because you just said some pretty amazing statistics. I mean, some countries aren't even 150 million people, and you're seeing those numbers in and out of your stores every week. So you really are a place where people convene.
Correct. We are, if not geographically, at least in terms of where people gather, the town center for a number of the communities we serve. And many of those communities are in rural locations or otherwise a little bit out of the way, and so don't always have all of the infrastructure that larger towns and bigger cities have. And so we really take that responsibility of being able to offer additional healthcare services, and in some places, this full service offering to those towns in particular.
In our remaining time with Dr. Vangilder, feel free to give us a ring if you want to ask him a question directly, or text us 651-989-9226. This coming in on the text line, Dr. Tom, could you ask if he knows anything about impact on fetuses? So I assume this is about the coronavirus.
Impact on fetuses of the coronavirus that we're seeing now.
My guess is if someone is infected or, could be carrying it.
I have not seen any reports on that. I know that there have been special warnings or notices for women who are pregnant regarding their health during an outbreak such as this. I haven't seen any reports regarding fetal health.
But in general, when a mother, has something like even a cold, how protected is that fetus? I mean, you think of the womb as a place that really does protect from a lot. Is that generally the case?
The body is really designed to nurture life, and so where there are these external infections, the body does have ways of dealing with them. Certainly, we know of instances where unborn children, fetuses, can be affected by the mother's health in these circumstances, but the body has a way of protecting life. So I would say we'll keep an eye on the recommendations and the science and the studies that are coming out. But for now, I haven't seen any special reports regarding that.
But what a great question. All right, Janie is calling in from Lakeville. Hi there, Janie.
Hi. I was wondering what you're doing for your employees with all those people coming through the stores. You read a lot about companies and how they're protecting their employees. Can you tell me what Walmart is doing?
Yes. Again, presumably in response to the COVID-19 situation, we are sending out information. We're making sure that the stores are supplied. They understand what the circumstances are in their communities, trying to make sure that they have adequate materials for frequent hand washing. They know about covering their coughs. They know about staying home when they're ill. So really re-emphasizing the public health messages and trying to help them continue to do things to the best of their ability. So really supportive of all of the Walmart associates that are out in the field and still working.
Dr. Tom, let's talk a little bit about testing, because I was reading this morning a bunch of different material on the need for testing. Are the tests out there? Are the kits out there? What can you tell us, and what should the public really expect? Again, I really like that you're sharing kind of the reality check information so people don't get unnecessarily alarmed, but we're also being very proactive.
Right, and with testing, as you saw, Roshini, in your reading this morning, it's a dynamic situation. There appear to be more tests being made available, more testing is being done. in the states, for example. And what we'll see as testing is done is we'll undoubtedly uncover additional tests, just as other countries did when they began more broad-based testing. CDC is continuing to work with the states to have the right recommendations given situations that are occurring locally. So I think what we'll see is greater availability of tests, an increasing refinement of what the testing protocol should be, what tests actually mean, what a positive test might mean, and then again, information flowing both from the federal government and CDC down to the state and local health departments and back the other way. I know I've been in touch with a number of local and state health departments as well as CDC. They are working around the clock, 7 days a week, communicating this information, learning and refining protocols, including testing protocols, to address the concerns not only of the public but also of the situations that are locally responding to the situations as they develop.
Dr. Tom Vangilder honored us earlier in the year, I should say last year, when I interviewed him over at the Minova Summit for the Real Leaders with Roshini podcast. You can check out his episode and learn a lot about what makes Dr. Vangilder tick, some very interesting background and interesting family information on that episode of Real Leaders with Roshini podcast. I really appreciate you giving us this reality check today on coronavirus and also, really talking about how a place like Walmart, which is such a hangout spot, a shopping spot, it's a community, a community hub for many people, and that you're really taking health seriously. And it's not just, selling goods and services. You're really wanting to improve the health of the community.
We do, Roshini. We really take our responsibility seriously and really want to serve as that center for well-being for the communities we serve across the country.
Well, I really appreciate you spending some time with us today. And I know originally when I asked you to come on, I didn't know that we would get into coronavirus. But with your expertise, I couldn't pass the opportunity. So thank you very much for all the good information, Dr. Tom.
It's my pleasure. Thank you, Roshini. It's nice to